Hello, and welcome back to my YouTube channel. So we're talking about how to deal with pain at home without medications. Now, have you ever wondered why athletes, whenever they get injured, or footballers, whenever they get injured on the pitch, they never actually use medications? Now, there are different reasons for this, but let's talk about it in this video. Hello everyone and welcome back to my YouTube channel. My name is Ifemide Molawao. I'm a physiotherapist. I am the everyday physiotherapist, and it's so good to have you joining for another episode on the Everyday Physiotherapist channel. Today we're talking about how to deal with pain without the use of medications at home. What is pain exactly? Pain is a complex, unpleasant, sensory, and emotional experience linked to an actual or a potential tissue damage. Now, don't get it all wrong and don't think it's a big word. It just basically means that when you hit your leg on something, you feel pain. That's basically what it means. So that pain, that feeling that you have, that ouch feeling that whenever you hit your leg against something, or whenever your children are playing football and someone hits the ball against somebody, that's basically what pain is all about. So it's not a different terminology, it's just medical term to explain. Now, when you hit your leg against something, or or your children are playing football and someone hits the ball against somebody, what happens is that that part that gets injured, the nerves surrounding the particular part send signals to the brain to tell the brain that, ouch, I got injured in a particular part. So the brain sends back, the brain also sends its own signals back and tries to protect the particular area. While all this is going on, this blood vessels around around that affected region also leaks into that particular part that gets injured. And you can see that sometimes swelling occurs in that particular part. Now, that swelling that you see that might look like something wrong is happening, it's actually not a wrong thing or bad thing. It basically means that healing is taking place when it's swelling. But take the lives of footballers whenever they are playing footballers, or whenever they are on the pitch or whenever they are running. When they get injured, you don't see the medical team running to them and giving them medications or a tablet to take. Instead, they see them spraying something around that person's skin. What they are spraying is called cold spray. Now, what does that do? Now, there's a reason why they don't take medication, which is why I'm going to tell you that, which is why I'm telling you that you do have to take medications for every pain that you feel or you experience at home. Now, what that does is also to heal the body parts. What that does is also to ensure the person gets back on the pitch. Now, you don't see them giving them paracetamol, because paracetamol takes about 30 to 60 minutes to set in, and they have to get back on the field. And also because of their safety rules and regulations, they have to go through the doping rules and regulations to ensure that an athlete or a footballer is not on any other substance. They also have to ensure that the person does not miss out on the game for a long period of time. So he or she has to get back on track. They also give that coach because of fast relief that it provides. Now, you can also use that cold spray at home, and then you'll be fine. Now, don't get me wrong. If it comes to an injury, such like fracture, where there's a broken bone or there's bruise, and you can see that something has broken in this particular part of the body, please, that is immediate emergency. Take yourself or your child to the hospital straight away. I'm talking about injuries where you just eat your children are playing football and then they eat the ball on somebody's, maybe the child's ankle or the leg, or you're coming down with stairs and then you miss a step and then you fall and then you sprain your ankle. You don't break your leg you don't break your legs, to be more precise. You sprain the ankle, you strain the ankle, or probably you hit your leg against something. That's what I'm talking about. I'm not talking about all those severe ones that you need immediate attention and emergency. This one is just to ensure that you don't get to use painkillers whenever you get injured, or for every pain that you feel. Now, when you get injured in that particular instance, you can just get what we call ice pack. In our homes, you can just put pure water, sachet water, you can put sachet water, put it inside the freezer, let it be blocked. When it's blocked, you bring it out, you break it, and then you wrap around the towel, and then you place on the affected parts of the body. Now, what this ice pack does for you is to help to numb that particular area, so that the pain sensations that you feel at these particular periods are numb. You don't feel them again. Your brain already closes up to that particular part because that cold is already working on the skin. Now, when this happens, you don't feel that particular pain, and then you can still carry out movements that you would like to carry out. So that is exactly the same thing that cold spray does for an athlete. It helps to numb that particular area for a period of time, temporary relief, till he or she is able to get more medical attention if there's need. Now, for you that you sprain your ankle or you have an injury to your certain part of your body, when you apply that particular thing for 15 to 20 minutes, you get relieved. Now, the pain might come back later when you move around again. You can apply again for the next 15 to 20 minutes. You can apply in an interval of 2 to 3 hours to relieve that particular pain, and then you see that you get better. So you can take like medications as well. Now, why all this? Why we can use this at home? There are also some conditions you don't use it for. Now, I mentioned that when there's an issue with broken bone or anything like that, please and please don't try to do anything at home. Don't try to go to the medical. Don't try to go to the traditional center, bone therapy to set the bone again. See a professional, a medical doctor. Please, that's the best way to ensure that you don't have issues in the long run. Because I've seen patients, I mean, that they were playing football or something like that, and then there's an issue with their bone, probably a fracture actually, not an issue, is a fracture, and then they go to traditional bone setters, and when they go there, what exactly happens is that they just help to, from what I've heard from them, they pull the legs and then they feel like they're okay, so they go back to the field. But mind you, when there's a fracture, you have to go for an X-ray. You cannot just treat a fracture without knowing exactly where the fracture happened, whether it's just a particular site that you can see visibly or it's more than that. So that's why it's better you go to the medical center than you just go to a traditional or try to do it at home. But with small injuries like one I mentioned, if a mild football injury or a fall from the stairs, something like that, please and please, you can just easily apply ice rather than using any painkillers. Now, if you're also if you're also from the age of, let's say, about 60 or 50 and above, 50 and above, and then you have small injuries like that, I will not 100% suggest that you use cold therapy, because as you grow old, the joint spaces between your joint spaces reduce, particularly if you get an injury to the knee. A condition called knee osteoarthritis, where there is a reduced joint space between the knee and then the synovial fluid around the knee joints are reduced. Now, when this particular thing happens, it means that the joints may or may not be the bones, I mean, may or may not be rubbing on each other. Now, when this happens, cold is a contraindication. That is, cold is not going to be good or beneficial for the individual. So if you're around that age that you probably have, or you know someone that has knee osteoarthritis, this use of cold therapy is not the best treatment for the person, because it can also aggravate and lead to more issues that you will not want to experience. So please and please, when you're using this ice pack at home, ensure that you're using it and then you don't have any allergies to cold, or you don't have any conditions that cold might affect it, like knee osteoarthritis. And that will be all in today's video. I hope you learned something new. Before we wrap it up for today, I will take you on a practical session. I had a patient coming for a session to the 16-year-old female who twisted her right ankle 2 days ago before she came in for a session while playing football. She was seen traditionally, and according to her words, they pulled her leg. She also took painkillers, but there was no relief. Her complaint to her pain when she stands for long and on palpation, it is when you touch, and also swelling around the ankle region. She walked into the treatment area in a painful gait. I examined and I saw that there was an obvious swelling around the region, pain when I touched, and she could not properly flex or extend, that is, bend or straighten the ankle. This was 2 days after the injury. Mind you, I'd sent her for an X-ray, and I was sure that there was no fracture or any other thing I need to be careful about. I explained all these things to you to help you know and understand the condition, and for you that might be going through something similar. So let's talk about what to do. We got ice and I broke it into smaller chunks. So you can see in this video, it has been broken down. But please, this ice is too small for the ankle region. And since that she has a big ankle, it's too small for her. So please let us more than this, whether you are the big size or not. Let's use more than this. I got a towel and poured the ice on the towel, then folded the towel. Depending on the place you are using, you may want to put a cloth under to avoid water messing around the area. Next, you see that I'm trying to wet the towel for easy absorption. So in this video, I couldn't get enough water, so I had to improvise. Then you wrap around the ankle joint or the painful area. The towel for this particular patient is small for the eye and also for her leg, for her ankle. So you can see me improvising the way I was doing. And I applied for 20 minutes. All through, I was asking her how she felt, what she felt, what should she expect. If you're asking, is that she shouldn't feel pain in that area, like the place is literally dead. That's what she's meant to experience or feel. So I kept asking her what she was feeling, and then at some point, I think it was about 10 minutes, she started telling me that she was not feeling any sensation again. So I knew that it was already getting to where I was going to, and then I left it there for 20 minutes. I didn't mention this earlier while explaining to you, but after applying ice, I did a soft tissue manipulation to drain the swelling to reduce the swelling. This is what people call massage. But as you can see, can you do this at home? Well. I would advise you to do this simply by rubbing the neurogenetic cream or the pain relieving cream around the area to avoid adding pressure on that particular place. As you can see me, I'm adding a little bit of pressure, but it's because I can see the patient's face. So for you that you're doing it at home, you would not know what to do or what pressure feels like, most like. So I would advise that you just apply the cream gently around that area and just leave it there. And then you can also decide to ask the patient to bend and then bend the ankle. I did that because I knew that the pain was already the ice was already effective and then she could not feel any pain. But while doing this particular movement, you can see me now trying to bend and straighten the ankle. While doing this particular movement, I kept asking her how she felt. I kept seeing her face also to see her reactions, know that she was not in pain that was unbearable. So please, if you're doing it for someone at home or for yourself, you might not want to. If it's for yourself, you can try to bend and also to straighten the ankle. But if it's for someone else, you might want to do tread you might want to do that carefully to avoid pain or aggravating the condition. But all in all, just you can just simply, to be on the safe side, simply just apply the cream and just leave for that particular period of time, or just simply apply cream and then bend gently to ensure that the person is not in any pain. So keep checking the person's reactions as well. After that, you can see me trying to tell her to bend the ankle, and she did that easily. That's basically to increase range of motion because one of the things she came in with was the fact that she could not bend the ankle before. So now that she's done with treatment, you can see that she can now bend the ankle without any pain because there was no pain as I was checking. There was no pain when I asked her. That's basically what the ice block does. It helps to numb that particular area and make the person do movements she cannot perform for a period of time. So she was able to do that easily. Now you can also see that that's why the athletes they can put something on their body, on their skin, and then they're back on the field and then there's no pain. So that's what the ice also does. So while doing this, I can put a pillow below the ankle to make it higher than the other part of the body also. And that is how to manage pain at home without use of medications. For today's video, and you remember that if you have injuries like sprains, strains, probably you go for exercises that you don't normally go for before and then you come back with pains all over your body, you don't have to use paracetamol to relieve you of that pain. You can just go for ice, you can just apply ice pack instead and then you feel relief without the use of medications. Now, before I forget, you can also use this. For example, you get injured in your workplace, you can just tell them to get your ice and apply it. Because I understand that workplace hazards occur, and then you want to use something, you want to get back on your feet as soon as possible. So rather than limping for the rest of the day, you can just get ice, apply it, then that would relieve you a lot from that particular pain. And you can carry out activities without thinking of how your day would be with the pain that you feel. So that will be all for today's video. Thank you for watching today's video. Don't forget to subscribe to my channel. Don't forget to like, share, leave your comments, and until next time, same channel. Bye.